In this video, I'll be demonstrating how to perform a stretch of the sternocleidomastoid muscle, which is normally abbreviated the SCM. You would perform this stretch if you have a tight SCM and possible anterior neck pain. A tight sternocleidomastoid is often associated with upper cross syndrome, chronically poor posture, stress and anxiety, and in individuals with chronic pain. If you wanted to locate your left sternocleidomastoid muscle, you'd actually rotate your neck in the opposite direction, so right rotation. And you should feel your left sternocleidomastoid muscle flare out. And you can see here that it's a longer muscle that traverses from the superior aspect of the manubrium of the sternum and the medial clavicle up to the mastoid process, which is located behind the ear. To stretch the sternocleidomastoid, the patient's going to be positioned and seated with their stretched side hand behind their back or under their buttocks with the palm facing up. So here, my left upper extremity is behind my back, so I'll be stretching my left sternocleidomastoid. And from here, the patient will add the following progression of movements until a sufficient stretch is felt in the stretched side sternocleidomastoid. So we'll begin with contralateral cervical side bending, not all the way, about 30 degrees maximum, followed by ipsilateral cervical rotation, same thing, about maximum 30 degrees, followed by cervical extension and possible manual overpressure and cervical retraction via activation of the deep neck flexors. Okay? So if I want to stretch my left SCM, I'll be performing right side bending, left rotation, cervical extension. Here's some manual overpressure, and I can also, as you see there, contract the deep neck flexors to get some cervical retraction. You should feel the stretch there on the left sternocleidomastoid muscle. Once again, stretch side upper extremity behind the back, contralateral side bending, ipsilateral rotation, extension, and manual overpressure plus cervical retraction. And you would hold this position for about 30 to 60 seconds per side that you're stretching. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.